So hi, I'm Amanda North. I'm the Executive Director for Center for Rural Health Innovation. I'm located in Spruce Pine, North Carolina, which is in the mountains in Mitchell County. We're about halfway between Asheville and Boone along the Tennessee line in the southern part of Appalachia. The program that my organization runs is called Health Schools. We're a school-based telehealth program. And for 14 years, we've been bringing healthcare services to kids in public schools, in rural public schools in North Carolina. And our flagship program, Healthy Schools, has been replicated and duplicated and adulterated. And we've gotten to see school telehealth spread all over the state and all over the country. I'm really excited to be an early innovator there. We pay a lot of attention to kids in schools and their teachers, faculty and staff who serve them to try to keep them healthy and at school. But here's this funny thing that's happening in rural communities, certainly in ours and maybe in the ones that y'all serve, and that is we've got a lot less school kids than we used to. And the demographics show that our populations are aging, right? And we have more and more old folks and less school kids. One of the things that's happening in our immediate area, in the town I live in, is there's not a lot of jobs for the working age families. So when people get married and start having kids, they realize if we're going to raise kids, we got to go to the city where we can make more money, where there's more opportunities for our children, and they don't stick around. And so what happens then is the schools have declining attendance. And you don't need a school to serve 25 kids or 45 kids. You stick them on a bus and you send them down to the town. So this is something that's been happening in our community. So let me tell you about the communities I'm talking about. In western North Carolina, my county is called Mitchell County. We've got about 16,000 people, if everybody's at home. And there's one good-sized town that's about 2,000 people. That's where I live. And then the county seat has about, 350, 400 people in it. So 2 towns in the county. The next county over is Yancey County. We're often paired together, even though we were on different sides of the war. But we try to let that go. It's been a few minutes. And they have one town called Burnsville. It's a lovely place. People come there for vacation all the time. You should check it out. But these 2 counties are quite small. We share a lot of resources. Historically, we've shared health departments, libraries. We've got one critical access hospital between us. But in Mitchell County, in 2011, we had 2 elementary schools close. And then in 2024, so this, yes, was 13 years later, we had 3 more schools close. Now, to be fair, they did build a new school. So it was the first new school we'd had in 25 years in the county, so super big deal, and a long time coming. But those schools closed and consolidated, and the kids spend a lot more time on the buses. In Yancey County, next county over, they lost 3 schools in 2019, but they gained 1. So they consolidated, right? Bus those kids further, it'll be all right. And then just that little storm we had last fall when Tropical Storm Helene came through, one of the older schools flooded and will not be reopened. It was slated for closure, so this is not a terrible tragedy, but it definitely happened sooner than anyone was ready for. So here's the cool thing, though, that happens when you close a school. People don't like that, and it will ruffle feathers. And people say, but that's our school. We've always had a school there. And they start getting together, and they make a community center, and it's a beautiful thing. And so the story goes a little bit different every time, but 3 years ago, we started working with Buladine Elementary School that had closed in 2011. The community group there who got a big federal grant to repair the roof, they built a gym and a food pantry, and they host a car show and an apple butter making, and they wanted to have a clinic. They wanted to have healthcare access. There is no financial sense to putting a provider in a little bitty wide spot in the road like Buladine. As much as I love it, it doesn't make any sense. But you know what does make sense is a telehealth clinic, right? So for 2.5 years now, we've operated a small clinic, about 15 hours a week, 20 hours a week, staffed by a very well-trained former paramedic, to David's point earlier. Paramedics keep popping up in conversation, and she's wonderful. She knows her community. She's been in everybody's house and helped scrape them up off the bathroom floor. And she's culturally competent, and she's way overqualified to operate our telehealth equipment and take vitals. But she's wonderful, and she's compassionate, and she helps people get access to care. And the Building Clinic is a terrific example. I wanted to tell you, in the 2.5 years or so we've been operating, we've seen about 300 patients at that clinic, right? So really, really low volume, but important when we're able to be a solution for somebody. So that's been going on, like I said, for 2.5 years, but then Helene happened. And I need to tell you that Helene was a super big deal in my community. My town had water, well, we had a lot of water. The main street, the lower level, all of the storefronts had water up over my head. And now my office is on the 2nd floor, so my office is fine. But my landlords, who own the bottom floor, not fine. It's really hard times, and it's been 10 months and we're still not okay. But we're coming along. But when Helene happened, a really cool thing happened in our communities is that all these volunteers came. They came to muck stuff out, and they came to build, and they came to search and rescue, but they also came to provide medical care. And so places like Building, where there was already a community center, and it's flat there, helicopters could land, right? This was a place that a lot of supplies started coming in, and Building just exploded, and it became a huge hub for food and resources and services. And there were volunteer medical providers there every day for 5 or 6 weeks. Something like 120 patient encounters were documented in October. And I say documented because I'm sure some happened that weren't documented. But we got 120 pieces of paper that say somebody was seen by one of these volunteer providers. So that's pretty cool. But then usual places of care reopened. People went back to their usual routines, but our telehealth clinic remains. Now, Building is not the only place that had medical care suddenly sprout up in the aftermath of the hurricane. Lots of little community centers popped up in old schools. How about that, right? Because those buildings were there and the community was itching for an opportunity to get in the door and have a place, and to make that a place that the community could gather. So, as the volunteers packed up and went home, as things returned to normal in so many ways, my organization started getting inquiries about, well, could we have telehealth like they've got at Building? And we said, let's make that happen. Let's see what we can do to make that happen. So in Yancey County, that's the other county, not the one where I live, excuse me, there's a little school that closed several years ago called B-Log. Literally like a tree on the ground with bees. I don't know why it's called that. I should find out sometime. But B-Log Elementary is an adorable tiny little place out in the Egypt Ramsey Township of Yancey County. So many words. It's fine. Don't worry about all the names. But they have built a community and relief center. And some nice volunteers back in October, out in the front lawn of the school, built a shed, like a 2-room shed. And some other volunteers came along and built a little ramp up to the doorway. And that's the nurses' station. And so since October, there's been an LPN volunteer as like the nurse's office at this relief center. And now I need to clarify that you're a 30-minute drive from a town of 2,000 people when you're at B-Log. And it's not an easy drive, and most of that road washed away. Okay, so it's not far, it's probably 18 miles, but it's a long way. Okay, just to clarify what we're talking about. So we started with this LPN who was volunteering, and she said, could we have telehealth? And so what we've done now is hired her, brought her into my organization as a very part-time employee, trained her how to be a telepresenter in our network, and now when she sees someone for more than a boo-boo or an ice pack, she can actually present them to our network, to a family nurse practitioner who can diagnose, prescribe, refer, lab orders, chest x-ray, send them on their way. We can't do those things. We can't do a chest x-ray in the little shed in the yard, of course, but we can write the orders so they can go straight to the hospital with it instead of having to go through the emergency room. The volunteers, the local fire department, and the funders, the very super hyper local funders, are all key to making that happen. Then we get to another interesting one, completely different, unrelated to closed schools, but still related to school kids, where another partner in our community, in my town, have operated a after-school program for the children who live in the subsidized housing apartment complex in our town. There's a community room that had been underused for many years, and so these folks said, hey, why don't we do an arts and crafts program for the kids, because they're coming from the Penland School of Craft. If you don't know Penland School of Craft, please Google it. It's lovely, and they're right in Mitchell County. So they come in, and these kids are doing arts and crafts, they're doing pottery, they've got their own kiln, they're doing all kinds of cool stuff, and they get help with their homework, and they get fed a healthy meal. So it's a win-win-win. Well, the coordinator for that organization said, well, can my kids use your school telehealth program? And I said, well, of course they all go to Mitchell County schools, don't they? They can use the... She's like, well, what if they need something after school? Ha-ha. And the idea was born, what if we put a telehealth clinic in that apartment complex? Because why not? Here's people who by definition are going to have a harder time with transportation, with access to care, with knowing how to access care, with feeling comfortable going to a clinic. It doesn't mean we have no transportation in our county, because we do have that nice little van that runs a loop. It's pretty cool. But you have to be able to take it, and you have to be able to wait for it. It doesn't always get the job done. So we are smack in the middle of building out. It's a one-bay garage across the way from the craft center, you know, where the kids are for after school. And we've had a wall built down the middle so that one side can be where the children repair their bicycles under adult supervision, and the other half is a telehealth clinic. We chose a really nice light blue, and we're borrowing some furniture from one of those schools that closed, and it's going to be great. It's going to be great. But we couldn't do it without the Housing Authority. We couldn't do it without the funder who's focused on digital equity, right? But put it together, it's digital equity to provide telehealth to people who don't have access to all the things. And then finally, the last one I would tell you about is actually a volunteer fire department. When it's a volunteer fire department, I don't know what it's like in your community, but in ours, there's not really anybody around unless there's a meeting or a fire, right? It's nice parking for the vehicles, and then like a great big hall where everybody can meet, and a big old kitchen. But it's pretty quiet otherwise, which is a perfect place for a telehealth access point, because we can set it up on an on-demand basis. If someone calls and asks for care, we send our presenter, they meet there, there's good internet, it's private, and in the off chance that something goes sideways, there's an AED available. And you know, that one we couldn't, again, possibly do without the fire chief and his wife pitching in. And in this particular community, which again is a wide spot in the road, wide-ish spot in the road, there is a little store called Griffith's, where if you want any information to get out into the community, you have to make sure they know about it. And I mean, you can hang up a sign, but that's not the point. You have to go tell them, and then they will tell everybody else. It's a beautiful thing. I love where I live, you know? It's amazing the kind of people that we get to serve, and the way that people pitch in and want good things for their neighbors. My organization brings expertise. We have a provider network. I've already got a group of nurse practitioners ready to go, and we're really good at creative problem solving. But then our partners in the community, you might be able to tell I'm not actually from Western North Carolina. I've only been there 19 years, so I'm not from there, and I never will be. But the partners who we work with, in a lot of cases, are from there. And they bring the trust, they bring the cultural competency, and the really clear view to what the actual needs are. Not what I think they are, or what problem I can solve. They tell me what the problem actually is. And so we need those relationships. So where we're hoping to go with this, I'd love to have more of our providers. I'd love to have providers who work for me who can do more things like behavioral health, in addition to medical, and that's coming. I would love to be able to connect to other local providers. What if our local federally qualified health center could see their own patients from our telehealth access points for more continuity of care? That would be amazing. I'm working on it. I know a guy. And then whatever other providers. I'm really excited about the presentation this morning about the VA opportunity. Wouldn't that be cool if my telehealth access points could also be living rooms? Because we certainly have our share of veterans who are more than an hour away. So I feel like there's so many opportunities out here, and by being open-minded and going where the need is and where people say, hey, can you come help us, will get us a long way.